I really developed a passion for helping women get pregnant. And I've spent the last at least 6 years helping them really get to a place where they can be proud in their bodies. If someone comes to me and they're on oral birth control and they want to get pregnant, first thing I'm doing is getting rid of that.
Isn't there also nutrient depletion with birth controls?
100%. You're depleting all your B vitamins, your magnesium, your CoQ10, all these things that are essential for mitochondrial health and your liver function. If they give me a year, I will detox the heck out of those people. There's one study that I read like years and years ago. They took these 10 newborns and they checked their umbilical cords right after birth, and they found over 287 chemicals in the cord. We used to think the placenta had some level of protection around it, and it probably does, but there's still so much getting through to the baby.
What do you think is the biggest mistake that people are making when they're trying to conceive?
I think the mistake is thinking that you can get pregnant in the first month.
This is Get Well Better, a podcast by the Lanby. I'm your host, Chloe Harouche. I'm very excited to be introducing Dr. Wallman, our new medical director. Dr. Wallman is a functional medicine doctor. She's also a family medicine doctor, also very well known for fertility, and has spent a good amount of your career at Parsley previously, and now is running show at the Lanby when it comes to care development and how we practice. So today we're going to talk about fertility because this is your sweet spot, and it's a topic that
Thank you for letting me.
we hear so much about. There's so much confusion and noise, and we actually launched a fertility program about 6 months ago to address a lot of the misconceptions when it comes to fertility wellness, and I think you could definitely add a layer to that. But one, I want you to start off by just like introducing how you got here. Like, how did you develop this passion and expertise? And then we can start with the basics, which I'll sort of introduce you into. But let's start with your background.
Yeah, so I'm a family medicine doctor. I did my training in functional medicine, and then through my own kind of fertility journey, I really developed a passion for helping women get pregnant. And I've spent the last at least 6 years being on some incredible journeys with women and helping them really get to a place where they can be proud in their bodies, and then they feel like they're in a really good shape to have healthy pregnancies. And then also women who had recurrent issues, and we worked our way through it. And I've just felt so blessed to be on every single one of those journeys with those women and men. A lot of times I got their partners in the conversation, and we had visits together, and it was just really wonderful. And I've just enjoyed the process. I've enjoyed meeting people where they're at and helping them get through it. I have some of my own feelings around it where from my experience with it, so it helped me to relate to what was going on, and then really doing my best to make sure I could show up for them in whatever version I needed to be to get them there.
Fertility is a topic that allows functional medicine to shine.
Like 100%.
Right? Like, it's so interesting how like you can sort of put a label on infertility, but really there are so many like underlying root causes that are affecting it. And it's not that you're infertile, it's that you have these other issues that are making your body hold back.
Yeah, no, I totally agree with that. And specifically, like, you know, when I was preparing for this and kind of our conversation, I was like, what would be ideal for me? And what would be ideal if a woman could come to me a year before they wanted to get pregnant? And I'm sure that if they showed up to their OB's appointment and they were like, hey, I'm here to talk about me getting pregnant in a year, they'd be like, come back to me in a year, right? And there's just so much that can be done in a year leading up to getting pregnant that a functional medicine and a health coach with a wellness advisor who can speak to all the nutrition and their lifestyle that can just move mountains for these patients to make it so that when they finally get to that moment of trying to conceive, it's not the stress, it's not the anxiety, it's I prepped and now I'm here. I'm chill and I'm strong and I'm powerful and I'm nutrient dense and I'm all the things I need to be to bring this life into the world.
Totally. Okay, so can we start with birth control? Because I think that...
oh gosh, girl, my like mission in life, and I know this is like not everyone's thing, is to get every single woman off birth control.
100%. So let's start there. Like, why do you hate birth control?
Yeah.
And when we talk about birth control, we're talking about the pill.
We're talking about oral contraceptives.
Yeah. So why do we hate it?
Yeah.
What's actually happening in our bodies that makes it then so hard to re-regulate once we come off it? Why do we have that? Where's that gap coming from? Yep. Okay, tell us all.
We'll go. So the reason I don't love oral birth controls, and If someone came to me and they said, hey, I don't want to get pregnant right now, I need to be on birth control, we have the conversation. We figure it out together. I'm never going to deny anybody birth control. If someone comes to me and they're on oral birth control and they want to get pregnant, the first thing I'm doing is getting rid of that. And the reason is it masks so many symptoms. It's used as a treatment to treat a disorder, whether it's dysfunctional bleeding or acne or something else that has a completely other reason for it, and they're given oral birth control, the symptoms improve, that's great, but you don't fix what actually was going on in the first place.
So you don't think people are on birth control for actual birth control?
The amount of patients who have come to me going on birth control purely for the reason of not trying to get pregnant is maybe 25% of the cases.
So should people be on IUDs instead?
I prefer an
What's the other
IUD.
way to
My scale for it is if I can get somebody on a copper IUD, that's great. Copper IUDs cause heavy bleeding. There's real symptoms that come with it. So if a woman walks in and they're already having heavy bleeding, I would never recommend a copper IUD for them because it will only get worse. A progesterone-only IUD, a short-acting one, like a Mirena or something like that, or a Skyla, has progesterone only. It's locally acting. You're not getting the systemic effect. So progesterone only, you're not getting the full impact of the estrogen that really I think causes most of the problem in women.
Right.
So it stays local acting. You're not dealing with the systemic effects of oral birth control, which is my biggest complaint for it. So oral birth control. So if my first option is copper, my second is the progesterone only IUD, and then my third is really a progesterone only oral birth control, and then my fourth would be a combo pill.
Okay.
And mostly because I just don't love estrogen. I think estrogen, I love estrogen, but I don't love estrogen when it's kind of uncontrolled in the body and it kind of causes other issues. We don't talk about the fact that with people go on oral birth control that they become anxious, they become depressed. We're all like, yeah, that's a side effect. You'll get through it. But that's not really the point. We're just swapping out symptoms, right?
Isn't there also nutrient depletion with birth controls?
100%. You're depleting all your B vitamins, your magnesium, your CoQ10, all these things that are essential for mitochondrial health and your liver function. You're depleting it. So like if I have someone who's on birth control, of course I'm going to supplement them with all these things. For the most part, it's kind of just...
Okay, so you have a year with a patient.
Oh, yeah,
You take
baby.
them off birth control. Either go on one of these other alternative forms of birth control or maybe even manage like naturally, like knowing their ovulation.
They're trying to get pregnant in a year?
Yeah, they're trying to get pregnant in a year. So you take them off. What are you looking for? Like what's the ideal scenario when they come off a birth control pill?
So when they come off, I wait 3 months before I test anything because it takes 3 cycles. I say 3 months and I really mean 3 cycles for your body to find out what its normal is again after being on it for whatever period of time. So if they've been on it for 10 years, say, because most women they start in their 20s, they're trying to have babies in their 30s, that's 10 plus years of being on birth control. We just see what happens, right? You have to just watch and observe the body for a little bit. Once we see that they're having a cycle, we check hormones. We check day 21 hormones are super important to me. That includes an estradiol, which is the E2, a progesterone, testosterone, sex hormone binding globulin, DHEA. These are all things that are essential, and LH, FSH. I do check an AMH, which is... I always went back and forth with an AMH because AMH, anti-Müllerian hormone, it measures your egg reserve, as some people like to call it. It's a number that can scare a lot of women, so I always ask if they want to know it or not. I use it as one of the other colors to make their painting, right, of the picture that is their fertility. So AMH is usually what I order. We do that around 3 months, and we just see what's happening with the hormones. Some women go back to cycling beautifully, and they do, and that's magical when that happens. Some women don't, and we have to support coming back, and usually it's supporting the adrenals to remind the ovaries how to ovulate regularly again.
How do you do that?
So we support with different things. Food first, right? So it's usually a mitochondria thing. So their mitochondria, your ovaries are so concentrated with mitochondria. So we have to kind of like bring them back to life. So that's CoQ10. Those are your B vitamins. Those are things to bring that back. Sometimes we use PQQ is another one that we use to bring it back. If that's not coming back, we do a cyclic progesterone. So we kind of try 2 weeks on, 2 weeks off, and we try to get their body saying like, oh, this is how the cycle starts again. That's when I get pretty deep into it, and it's been a couple months of them not being able to get their cycle back. So there's strategies that we use along the way. But we focus on nutrition, we focus on sleep, we focus on stress, and those are kind of the basics.
When you talk about the mitochondrial repair, though,
Yeah.
I feel like a lot of what you mentioned are supplements.
Yeah.
Are there specific foods that you should be eating
Yeah.
to support your mitochondrial health?
It's your cruciferous vegetables, it's your protein, it's the things with the micronutrients in it. You want polyphenols, you want things with a lot of color, a lot of different color on your
So a
plate.
lot of vegetables.
A lot of
And
veggies,
fruits.
heavy veggies. You want fats. Your cell membrane is made up of fat, so it requires fat to produce. You need cholesterol because that's what makes all your sex hormones. So these are, your
eggs.
food is what makes it. Eggs, fantastic. I know eggs have had like their life
Oh my
of
God.
controversy. Yes, no, whatever. Eggs
Everyone
are in,
wants to
okay?
shit on the wellness industry. They say, but the eggs.
Eggs, I know.
The eggs. Like, get your story straight on
know.
eggs. I'm like, listen,
Yeah,
it's not
I
our
know.
fault.
You get yourself some clean organic eggs and
love
you're
eggs.
good to go with eggs. Eggs are like the best nature-made protein morning you can
And
have.
protein and fat,
Yeah. So I'm all in on eggs. So mitochondrial health is huge as far as rebuilding their cycles back. If they give me a year, and I truly have a year, I will detox the heck out of those people. There's one study that I read like years and years ago that they did a study. It was a very small sample size on these. I think it was only like 10 newborns, but it was enough. It was by the Environmental Working Group did this. And they took these 10 newborns and they checked their umbilical cords right after birth. And they found over 287 chemicals in the cord blood.
Oh, I heard about this, yeah.
It broke my heart.
Yeah, it's so
And these
devastating.
women were not toxic women. They weren't whatever. They were normal women functioning in our day-to-day life with plastics and chemicals and like the forever chemicals that are just in their poor babies at birth. And we used to think the placenta had some level of protection around it, and it probably does, but there's still so much getting through to the baby. So my job is to minimize toxin exposure before you even put that baby in your body.
So what else are you doing to detox?
So to detox, I usually work people through a pretty intensive liver detox protocol. That includes doing things like glutathione and doing like all your B vitamins, phosphatidylcholine. These are things from a supplement perspective. From a lifestyle perspective, we're talking like saunas. I get people sweating in a meaningful way. I get people exercising so that they naturally sweat, and that mobilizes your lymph system, which is your garbage system. I get people sleeping incredibly well because that's when the whole body does their clean out, your cellular turnover at night. And so it's really just making sure that they're totally detoxified. And they open your detox pathways. I make sure that their gut is working well because that's your garbage system. If you're not having regular bowel movements, you're not getting rid of the toxins every day. And that's where it's really important to make sure that they are detoxed. And then with the detox, I have to make sure that's at least like 3 months away from when they start trying. So that's why if they give me a year, I just say, thank you so much. I love you for coming to me this early so I can do all these things for you. Once we're like 3 months out, I start them on their prenatal. I have my little like trifecta, I call it. So I put them on their prenatal, their high dose CoQ10, and then their high dose fish oil. The prenatal most people are on because they know they're supposed to be on a prenatal. The CoQ10 is mitochondrial health, and I put usually about 200 milligrams, or what a lot of the IVF studies did for that. So I put them on about 200 milligrams. I say share with your partner, by the way, because it helps with sperm quality. So I have them share. And then I put them on the high-dose omegas. And the omegas are important because when you look at an omega, there's EPA and DHA, right, the omega-3s. And you need to make sure you have a well-balanced one in the beginning. Once you're pregnant, I make sure I switch over to like a DHA-heavy one because that helps with brain development for the baby. So I switch over a little bit. And the EPA is more of like an inflammatory one.
What do you think is the biggest mistake that people are making when they're trying to conceive?
It's a great question. There's two answers to that. I think the mistake is thinking that you can get pregnant in the first month. Like,
Really? People think that?
so many people think that 30% of couples get pregnant in the first month. Once you get to 6 months, you're around 75%. And it's usually somewhere between 3 to 6 months most people get pregnant, right? And so I dispel that. I also go back to like the super basics. I cannot tell you how many women come in and they have no idea what time to have sex. Like, no idea. They're like, I tried having sex right after my period. I tried having sex right before they don't know that there's only this little window of time. It sounds so like, obviously, because you have kids, I have kids, like we know that now. But so many women came in
Not knowing about ovulation.
Not knowing about ovulation and not knowing that there's a window of time that you can really get pregnant within. And so I pull up this like super esoteric like chart that shows the flow of all the hormones that are happening throughout the cycle. And I'm like, this is your window right here. You see this surge with the LH? You have to have sex right now during that time. And I take the stress away from it too, because it's also like the first 3 months should be fun. Light some candles, put on some cool music, like make it nice, right? Like don't say like I need to sit there with my legs in the air and like try to get pregnant. This is supposed to be just 3 months of fun trying. So I emphasize that for them, that this is fun, enjoy it, don't put too much stress on it. I educate them on their timing so that they know when to have sex. Once we're kind of like in the process of trying and we've gone over 3 months, that changes the story a little bit, and because I want to make sure. I'm getting ahead of it a little bit, because I really will say that if someone comes to me in their 20s, late 20s, and they're trying to have a baby, we're focusing on toxin removal and like cleaning up, no alcohol prior to it, certainly no smoking, remove anything that you might be exposing to with skincare or whatever. If they're in their 30s, it's mostly stress. It's mostly these like super motivated women who have been working their butts off in their career, doing amazing, and they're like, oh my God, wait, family time. And then it's like all about how we optimize their response to stress. You're never going to remove stress. It's how you...
So that's the pattern that you're seeing, that people that are trying to get pregnant in their 20s, it's not a matter of stress.
That's toxic.
It's just a matter of alcohol.
You were made to have babies in your 20s. Like that's
and then when you get to your 30s, it's really because you've clearly prioritized your career. You've met someone later in life, maybe.
Well, our society is set up to have babies in our 30s, not in our 20s, unfortunately. And women, you know, one day I would love for us to kind of reshuffle that a little bit, and women can safely have babies in their 20s and not feel like they're missing out on some portion of their life or falling behind in the work world. But until that day happens, we are meeting my wonderful patients at 34 who are trying to get pregnant. They're having a harder time and they don't know how it happened.
How do you know if stress is the root cause? Are you just looking at
Great
cortisol?
Question. No, come on, girl. I have to go more. So I lead with numbers, because numbers resonate with people, right? People, especially these like perfectionist women, right? They need to know numbers. They need to track. Whatever's not measured isn't managed, right? So I check all these hormones. So I'm checking our day 21 hormones that I think of. I'm checking DHA. I'm checking cortisol. I'm checking a thyroid panel to make sure that we don't miss any kind of low-hanging fruit on a thyroid. I'm really trying to analyze their and insulin, right? Analyze their response to stress. So all of that you can encapsulate in blood work. While we're waiting for the blood work to come back, I say you got to pick something that makes you happy in life. Gardening, coloring, knitting. I used to have a patient that made like quilting patterns. I don't know what that is. She didn't quilt, but she like made these, I have no idea, but she loved it and that made her happy. And that was her like 5 minutes of meditation that she did in the day. And you know, meditation doesn't have to be sitting there quietly to yourself. It's anything that puts you in a calm, relaxed state where you can only focus on one thing at a time and kind of let the rest drift away.
Yeah.
And so I have them get into whatever their thing is. When the blood work comes back, that's when I say, hey, your DHEA is starting to go down. Your cortisol isn't where we need it to be. You know, if we're able to get a saliva curve, we're able to like really point it out to them that they're not getting their peak in the morning and nicely having a nice evening dip. And we start addressing wherever the problem is. But I agree with you. I think where your point was is being just told, oh, you're stressed, that's the problem, is difficult for any woman to hear. And so I have to contextualize why I think they're stressed.
So I want to understand exactly, like, when you say you're doing all of these labs, what does stress look like on
those labs? Great question. So a woman with high stress usually has, depending where they are at in their chronic stress journey, they either have a super high DHEA or they have a super low DHEA. DHEA I call the mother hormone. It gets turned into either cortisol or estrogen when it needs to, as it goes through its path. If your body is under stress, it will always prioritize making cortisol because its job is to keep you alive, not to reproduce. Reproduction is a luxury in the body's world, right? Hair, nails, and reproduction are the body's like luxury items that when everything's working fine, you can have beautiful hair, strong nails, and you can have babies. Those are not essential to life, unfortunately. And so when your body is highly stressed, DHEA will always choose the cortisol pathway. It's not going down the estrogen pathway. If it's always diverting towards cortisol and you're not getting the estrogen, you're not getting this peak right before LH that is critical. And I think this is one of the most overlooked fertility moments. And I can get into a little bit more if we want to.
Yeah, I want to.
But there is this point in time where this estrogen has to build around day 9 to 12 of your cycle. And then that allows the LH serve. So everyone knows about ovulation strips and LH testing, right? But no one really talks about the estrogen so much. So if this estrogen curve doesn't get quite high enough, it never hits the domino to make the LH surge happen. Or it hits the domino super late and LH is surging around day 21 of your cycle. If you're surging around day 21 of your cycle, it's a post-mature egg. The odds of it fertilizing are so much lower than if you ovulate around day 14. So all this goes back to cortisol. If your body is making DHEA that's turning into cortisol and you're making just like a little bit of estrogen, you're never making enough estrogen to get your LH to peak at day 14. And if it's not peaking at day 14, you're not releasing that egg, and then nothing can get fertilized. So to me, if you want to really look at the numbers, I have women get their test kits, and not just a regular test kit that checks LH, one that has estrogen. This is Clear Blue Advanced does this. If you want to just do it over the counter, or there's Mira, there's a million other ones out here. Not a million, but there's a handful of ones that are doing it right with estrogen, because if you're just checking LH, you're missing the boat. So an estrogen and LH testing strip, you start checking that for a cycle or two. And if you notice that this surge is happening later on, you got to push it back to day 14.
And how do you do that?
You have to support the adrenals. The adrenals have to be able to amount that estrogen response. We'll tell the ovaries.
So what does like the lifestyle of someone who is supporting their adrenals look like?
Yeah.
Because when we talk about stress, like I'm automatically thinking about hypothalamic amenorrhea, which like I'd love for you to define what that is. But to me, that's what maybe it's severe stress looks like. Like I remember when people used to ask me, "Are you stressed?" I'd be like, "What kind of question is that?" Like I'm just living my life. You know, I'm a high achieving, high performing
woman living in New York City. What do you expect me to be like?
I want to get a lot done in the day. I don't view that as stress. I just look at that as efficiency. You know, every minute of my day has to be accounted for in some way. But if you were to ask someone who's trying to de-stress me, they'd be like, that's a horrible way to live. So what's like a lifestyle of someone who's trying to regain their adrenal support?
Their adrenal support. You're never going to remove stress from someone's life unless you tell them to quit their jobs and move to the middle, like an island somewhere. You're never going to remove stress from someone's life. You have to teach them how to be adaptable again. You have to teach them how to go into stress and come out of stress and not just live in stress. A lot of that's rumination. A lot of that is just feeding these thoughts into our brain that says, wait, what do I do for this? Oh my gosh, I forgot about this. Oh wait, I need to do this next. And you're just kind of feeding those things forward. And it's first by identifying if you're doing that or not. Are you doing that all day? And if you are, can you break the cycle of it? Can you come back and say, oh, I noticed I was having one of those like spiraling thoughts. I need to pause and reset a little bit. There's a lot of techniques out there. Tapping techniques are amazing. EMDR can help reset some of these things. So there's like the psychiatry ability to do this. I would say finding something that brings you pleasure and doing it for 15 to 20 minutes a day is where I start with most people. That could be reading a book. I mean, some of these like smutty novels that are out there have like changed the world for some of these women because they're just relaxing, reading something they enjoy and not thinking about the 700 things they have to get to in the world. So what does it look like? It looks like finding either a moment in the morning or a moment in the evening, or this was like my favorite hack that I would do is like whenever you arrive someplace, get there like 10, 15 minutes early and just sit in the car before you go into your house. Or if you're like 15 minutes late to get home for your kids, whatever it is, or get home for your partner, sit in the car, take some deep breaths, reset your nervous system for a little bit, and then go on to the next thing. It just shuts off one thing and goes into the other thing. There's a lot of work that people have also done around eating. Like before you sit down to have your meal, bring your body out of sympathetic drive and bring it into parasympathetic drive. It's going to do wonders for your gut health. It also helps you kind of take that moment to get out of that fight or flight response and into that rest and digest place.
So what do you do for that?
So when you're about to sit down for a meal, don't do it in front of a computer. Don't half work while you're eating. Don't do it while you're on your phone. Sit down, be present in your meal, take deep breaths, chew for 30 times or whatever they recommend you to do for each bite. Oh. And I know, right? But that's the thing. So those are simple, right? Like, I know telling you, like, chew 30 times before you swallow. Like
30 times is a lot of times.
I don't know what it is. It's like 20 or something is what they recommend. 20 to 30 is what they recommend, which is a lot. But that slows you down, doesn't it? Like,
yeah, but too much. Like, I think it would take me, like, half an hour to eat my meal.
But maybe you need that.
Right, maybe.
That's the thing. That's the thing is you filling the time is tricky.
So the first thing to go when you have stress are your hormones, like your sex hormones.
Eventually, yeah.
Oh, so that's eventually. That's not the first thing.
It's
to
if
be
you're in your
affected.
20s, you have so much resilience built into you. Even your late 20s, 26 to 29, you have so much resiliency built into your body that you can handle working that 80-hour work life, sleeping 4 hours a night, and like doing it again the next day and going out and partying on the weekends. Like the resiliency is unparalleled in your 20s. When you start hitting your early 30s, that resiliency just starts waning. And you can't do it the way you did it in your 20s. And that's a hard reality. Unfortunately, that's when all of our women are now trying to get pregnant.
Yeah.
Is when their resiliency is weakening. And now they're saying, hey, reproduce and do the most like intensive thing your body has ever had to do when you're most depleted.
Yeah. Yeah.
It's no wonder.
It's crazy because I feel like I'm doing all of those things. Maybe I'm not doing all those things, but I'm really trying. Yeah. And I think getting your hormone levels back is so much harder than it sounds.
It is.
And so going back to the original point of being proactive, it's like I just wish that I had been more thoughtful about fertility wellness when I was just starting my wellness journey.
Totally.
Because I don't think I would have been as extreme as I was, and I wouldn't have caused as much damage. Like I do think a lot of the damage is really hard to reverse.
Really hard to
reverse. You can't just flip a switch and be like, okay, I'm going to be super chill now.
I call it a pendulum. However far you pulled it to one side, you have to pull it equally as far to the other side to reach the middle again, right? So if you were pulling your body so hard in this direction, you have to bring it back here to even level it back out again. It's not just like, oh, I did a little bit better. You're never going to average back down to where you need to be.
Yeah.
But you really have to swing it the other way.
Do you see that there's like similar issues with women for their second pregnancy? Because I hear that that's also like an increasing problem is women who had no issue getting pregnant the first time, the second time for some reason they can't get pregnant.
That was always the mantra that I heard is like, oh, your body did it once, it can do it again. And I believe that. Your body learned the process to some extent. The body is now going into it in a much different place for round 2, right? You're depleted. You have a newborn who's not sleeping. So you just put yourself through the stress of pregnancy and then birth and raising this little human being. Like you're more depleted than you've probably ever been there. So that's where it really takes, it's tricky when you're getting the timing for people. And this is where every journey is personalized. I usually ask my women to wait at least a year, if not like almost 2 years before they consider having their second, because it is so hard. And you are so depleted in all your nutrient levels, in all your adrenal stress to be able to rebuild yourself to a place to do all of that over again.
Yeah.
And your body knows, like your body is smart. I mean, I was an evolutionary studies minor and like everything about me, like radiates that like we're meant to reproduce. We're designed to reproduce. You have to get yourself back into a place from a resources and a homeostasis kind of place to allow your body access to do that. Yeah. And that's really like simplifying this because it takes a lot of work and a lot of effort, and a lot of women are on tricky journeys to get themselves back to a place where their body feels safe again to have another baby.
Yeah, wild. Okay, well, I could go on and on and on.
We'll have to talk more about this.
So many million questions. I know our audience does too. But thank you. This was so enlightening, and I know a lot of people are struggling with this and feel like there's just something wrong with them. But really, it's literally just life.
It's life. Our environment in which we're trying to make these little humans in that is really, really tricky. And so we're trying to combat all of that.
But ultimately, the takeaway is give yourself time.
Give yourself time.
Whether it's your first, your second, like give yourself time because that's going to be the most, measured way to get the outcome you want without the stress of time.
You're creating a human that you're hoping is in your life for many, many years. Put in a year of effort.
Yeah.
It's wild.
Seems obvious.
Right?
Yeah.
Put in a year of effort to get you there.
Yeah.
So.
Thanks.
Of course.
So fun.
My pleasure.
Well, we'll have you back for sure soon.
Yay. Thank you.
Thanks for tuning into this episode of Get Well Better by the Lanby. Your support truly means the world to us. Make sure to subscribe on YouTube and Spotify or listen wherever you get your podcasts. Follow us on Instagram at the Lanby for behind the scenes content and updates. We would not be able to grow without your support and referrals. So please send this podcast to a friend, a loved one, anyone who you think is interested in learning more about health and wellness and navigating this maze of an industry.